Hello and welcome to IndiGlobal Media Network Edge Factor. ये IndiGlobal Media Network Edge Factor का दूसरा इंग्लिश इंटरव्यू है. हम इस बार वर्ल्ड हेल्थ डे जो अप्रैल 7 को है उसके बारे में डॉक्टर आशीष चौहान से बात करेंगे. डॉक्टर आशीष चौहान is a general physician with Apollo Hospitals with 20 plus years of experience. He has also been awarded in 2016 the IndiGlobal Medical Excellence Award by World Medical Council. Welcome, Dr. Chauhan.
Thanks for that nice intro, Kaniza ji and all the friends. Thank you.
Yeah, thank you and welcome. Climate change is a reality, doctor. और अब हम देख रहे हैं कि बहुत ज़्यादा गर्मी है या तो बहुत ज़्यादा बारिश है या floods हो रहे हैं या बहुत ज़्यादा cold है. Given the climate change, which is a reality now, what are the challenges physically and mentally in humans that are expected in the next few decades?
Thanks for very nice and pertinent question, Kaniza ji. जो ये climate change की हम लोग बात कर रहे हैं वो बहुत ही important है, बल्कि I see lot of youngsters also talking in the international platform also, which is very much needed. How does it affect you and me and everybody? It affects in every way possible. The physical, mental, financial, all the aspects of an individual and country gets affected. Yes, we are seeing extremes of weather. We are seeing extreme disasters also. Lot many places like Australia and all, we see that there are fire which we are not able to control it, and there are floods. So the whole ecosystem of the world and environment is getting affected slowly and regularly. So it's a duty of all of us, and I congratulate Edge Factor to have brought it out this important point, because I was talking to my son and I was telling that it's important that we are in sync with the nature. It's important that we are disciplined in our approach and in our living day-to-day life. And ये एक हमारी मानव जाति को समझना बहुत जरूरी है. जिस तरीके से we have seen the rampant use of plastic and the rampant use of misusing the resources, I'm very much sure our future generation is going to pay a big price. And इस सब के लिए we are already late, ये मैं हर किसी को बताना चाहूंगा. So we have to do our part in our limited circle wherever we are. And climate change is going to affect us physically, where we will have more cases of diabetes, hypertension, new viral infections which will come up. There is a cycle which it goes. The bigger fish always eat the smaller fish. So like that, there is one very big, a balance which nature maintains in a proper form. And our intervention is actually breaking that cycle. And that will have suddenly one rise of one particular species, and one species will be absolutely less. And it's our duty that we take consideration of this. We understand one old statement, Kaniza ji, which I would want to tell all my students, viewers, and wherever I kind of find to share, is Ati ka bhala na barsna, ati ki bhali na dhoop, ati ka bhala na bolna, ati ki bhali na chup. So climate change is about ati from humankind wherever we are, and we better learn a lesson before it is too late.
Yes, well said, doctor, well said. So इसका मतलब ये हो सकता है कि अभी जैसे हमने SARS-CoV-2 का वायरस देखा जो चाइना से आया था, वैसे ही कोई दूसरा स्पीशीज का वायरस भी आ सकता है, बिकॉज वो जिस स्पीशीज में रहता है वो अगर वो उसका बॉडी उसको सफिशिएंटली अवेलेबल नहीं है तो उसको फिर सिर्फ ह्यूमन बीइंग ही मिलेगा जंप करने के लिए. तो अगर ऐसा होगा तो हमको क्या इन्फेक्शियस डिजीज ज्यादा दिखने वाली है इन द नेक्स्ट फ्यू इयर्स?
कौन सा स्पीशीज सबसे खतरनाक मानती है मैम आप? There's no more dangerous species than human species himself. And I hope I'm not making a politically incorrect statement. Ukraine and Russia ka war is trying to tell us one species who is actively engaged in destroying themselves is human only. And yes, so yeah, with that note, I would definitely want to admit that yes, we will have the resurgence and the rise of old existing diseases and the new species in our ecosystem, and we as a clinician need to be ready for it, and we will be paying a big price also. ये कोविड सार्स के समय the maximum in action has been our fraternity, which I salute them for, and I'm very happy that we did our part. And the biggest losers were us, the doctors, because one profession which has the maximum, the people who gave their lives during the COVID fight is medical professionals. After having said that, the emergence of new viruses, bacteria is very well expected. Nowadays, whether it is a natural or it is lab generated is another question. So the responsibility finally falls back on the media houses as well as on the common man. We have to understand, when we are voting, when we are taking the stands, are we taking a stand for a big common, mankind, or we are seeing a short-sighted, benefits? Because these viruses and bacteria and the pandemic are by natural way are they coming, or instead of pandemic are these the pandemic? We need to understand that, a common man and a human being need to understand, is it normal, or is it something which is man-made, and what we can do. Remaining silent is not an answer which we can, or a stand which we can take it. We have to understand that this pandemic or this pandemic or whatever we call it, we have a role to play, we have a voice to raise, and we have a move to take. We have to take a stand, and we have to take our right step in teaching our children, in telling them that silence is not an answer, even especially in this world where we have a social media which connects us and educates us. We have a big answer which we need to give it to our society, and be ready for it in future also. Say, I would want to tell you one thing, Kaniza ji and everybody else. Same thing we had in 1918, the Spanish flu. Apparently,
Yeah.
there is a speech by George Bush, the president of India, of United States in 2005. There will be a pandemic which will be coming soon, and they had predicted in 2018. I am not a scholar to talk about it, how do we predict, how we don't. But I am the only one who would want to say it is, be ready, play your role, do your part, vote correctly, the act properly in the given situation. One video I remember which says, do right always. And I think if that is what we as a parents teach our children, then that's a right thing which we are doing for our future, and that's what is needed. So yes, we have to be ready for the future attacks, whether it is virus, whether it is robotics, what we see it as a AI coming up. A responsible citizen have to be ready always and prepare always themselves for the worst and fight it out, because humanity is all about survival of the fittest. Never to forget the Darwin's theory.
Yes, yes, very true. And it is the survival of the fittest. So, how do we balance now? Given the climate change, our food is a challenge, hygiene, clean energy, all these are subjects where we are finding that pollution is the biggest problem that we see in all of these. So, now where is the balance, and what and how will the healthcare systems world over be geared up to deal with it? Because ultimately when people fall sick, they'll come to the hospital or to the doctor, and how do they deal with it?
Hygiene and pollution and the pandemic and the future. Everything starts with the spirituality and ends with the spirituality. I get the opportunity and tell them, everybody, we need to be connected with our creator always, because that is what will guide us to the right thing, is what I would want to tell you. And I say that is there, mazhab nahi sikhata aapas mein bair rakhna. Why I'm making such kind of, a statement as a doctor? I realize a doctor's job of being a curative physician is an old gone thought, and it is wrong. Just before starting this session, I was training my DNB students and I was telling them doctors shouldn't be anymore one who treats complications, but doctor is the one who should be the prevent complication, who should prevent disease. For all of my friends out here, 7 C's will kill you. If somebody wants to note it down, or if we can edit it and scroll it down, that will be good. The 7 C's are CAD, the heart attack #1 killer. The CVA, the #2 killer in the world, that is paralysis. The third is the CKD, CLD, that is chronic liver disease. C is COVID-like infection. Final C is casualties like road traffic accident and floods. And then it is cancers. If we remember all these C's and we work for it, then it is a big duty which we will do it, big responsibility, we will shoulder it. I would want the three pillars of the society to rise up: the father, the mother, and the teacher, because they are the ones who teach our generation, who taught us, and they will continue teaching the future generation. We have to understand what my father and your father taught us always: prevention is better than cure. We have to understand honesty is the best policy. If we stick to these basic rules, we can fight out any pandemic or pandemic. What we need to teach to our students, our children, the hygiene, which is being time tested. When we say Assalamu alaikum from a distance and we say Namaste, our culture teaches us that, hugging is always good with respect to, giving that leaning shoulder to lean on when you are about to commit suicide. Stress is the big killer. But overall, maintaining our distance and, that saying that, yes, we respect your physical presence, but we still maintain a distance, because I don't want you to be infected from me. I don't want me to be infected from you. And that's a very right way. So if we can stick to our basic things which our parents taught us, there is, what is the best culture? The westernization? The answer is no. The easternization? The answer is no. The answer is only amalgamation of both. We have to understand that evidence-based medicine has to have a touch of Ayurveda, homeopath, and above all, a blessing of a spirituality with which we all have grown up. We come from an essence which we have taught by our blessed books. We call it as a Bible, Gita, or Quran, and we stick to it.
Yeah, sure. And doctor, could you let us know? See, there is always a challenge in understanding the right kind of information, because you have recognized bodies which give out protocols, which give out letters, and which give out which issue statements. And in this present times, we have seen the World Health Organization, the and many other organizations of doctors have associations have given out their protocol letters and also said this and this is what is to be done. But ultimately, when things were evolving, there were certain changes also found from time to time where they had to upgrade it. So given this situation, people are often confused what is right, what is wrong, and then there is a flurry of information which is pouring in from everywhere. So people, a common man is always very worried as to what am I supposed to do. So for him, his one contact is his doctor, and if one doctor says this or the other doctor says this, he's totally confused. And this is what we are seeing in the present times. So is there must be a standard method of taking things forward, and is it, if that standard method is put up to people, will it not make more change for everybody?
You have asked me one of the very toughest question, and I hope I do not confuse when I answer this. In this present day of commercial world, which information is right and which is wrong is very tough for a doctor like me also to find out in 20 years of my practice. I have been through many kind of diseases and through various platforms, and I would want to tell my blessed viewers, if you are worried about health of your family, you need to go back to the doctor who you always invited for every function in your house. The commercial interests of the present day world has killed one person called as family physician. वो डॉक्टर चाचा जिनसे हम लोग 20-30 years बैक मुला करते थे. द पीडियाट्रिशियन जिसको हम लोगों ने 4 और 5 years से देखना शुरू किया, 15, 16, 25, 30, 40 years तक ही मिलते रहे, जबकि वो बताता रहा कि बाबा यू हैव टू गो टू अ फिजिशियन नाउ, यू आर नॉट अ चाइल्ड एनीमोर. And then suddenly there was a huge world of marketing which drifted us apart. How do we select a right therapy? How do we select a right doctor? Listen to your heart. Submit to your creator. I like giving the spiritual quote because that's what is the first thing which we need to do it. Isn't it that Gita says जो हो रहा है अच्छा हो रहा है, जो होगा अच्छा होगा, जो हुआ वो अच्छा हुआ? Isn't it Romans 8:28 says everything happens for the good for the ones who trust the Lord? अपने दिल की सुनिए, अपने डॉक्टर चाचा की जिससे आप 20 साल का कनेक्शन रखें उनकी सुनिए, एंड राइट इंफॉर्मेशन को गैदर करिए. इस समय की जो इंफॉर्मेशन गूगल पे अवेलेबल है, you know, we have as a responsible Googlers have to understand कि it's a commercial world and we have to be careful getting into their grab, into their hands. Stick to one doctor who you believe in regularly. Listen to her consistently. Listen to 3 people in your life and you will never be confused. Number 1 is your parents. Number 2 is your spouse. Number 3 is the doctor who you've been to. I hope that is clarifies my stand for you. And if you're still confused, talk to your God. You will get a right answer. The problem is there is not a overflow of viruses. There's overflow of misinformation, and that is what is scaring everybody around. I think we need to be selective in what we watch, in what we read, and that is what is very, very important. Somebody gave me a lift, and that boy was telling me he was a youngster from Mancherial. He says, "Sir, where do you live?" I told him the name of the society. He says, "Oh, then too you must be minting money during the COVID pandemic." That's what he's heard.
Yeah.
And I said, I am the doctor who apparently is trying my best, making sure that patient never reaches hospital. We know each other and I work regularly on the social media. So people have a very wrong concept of a doctor. And the best way to reach out to a doctor, if this acronym can be the punchline for this discussion of ours, is go to a doctor when you do not need him.
Yes.
Dear viewers, listen to this very clear cut. Go to a doctor when you do not need him, and you will never need him. If this thing is people understand, we have patients who come to us in the last stage, and in last stage the treatment will be costly. We have issues. Dengue can be treated for 50 rupees and 500 rupees. The same thing with COVID also, 50 and 500 rupees. The same thing when gets complicated, even 5 lakh rupees will not be sufficient. 50 lakh rupees you spend and you will get the dead body. The problem lies that the people come to us late. If that they understand, I think that will be the right message. I am leaving it here on this platform.
Yes. Thank you. And thanks, doctor, for touching on this. Doctors are minting a lot of money because आजकल जिससे भी बात करो वो यही बोलता है कि लास्ट 2 साल में तो डॉक्टर ने सबसे ज्यादा पैसा बनाया है. बट सिंस वी आर इन द फ्रेटर्निटी वी नो दैट कि वो सच नहीं है. देयर आर मेनी डॉक्टर्स आउट देयर जिन्होंने काफी पेशेंट्स को घर पे ट्रीट किया है एंड दे हैव नॉट अलाउड देम टू कम टू द हॉस्पिटल एंड हैट्स ऑफ टू दोज डॉक्टर्स बिकॉज दे हैव एक्चुअली वर्कड इन द पेशेंट्स इंटरेस्ट. तो अगर हमको ये बात सोसाइटी में बाहर लानी है तो व्हाट इज इट दैट द डॉक्टर्स आल्सो शुड डू. बिकॉज देखिए एक तरफ से एक कैंपेन है कि द डॉक्टर्स आर मिंटिंग अ लॉट ऑफ मनी बट द फैक्ट इज आल्सो दिस कि सब डॉक्टर्स ने पैसा नहीं बनाया है एंड देयर आर ओनली सर्टेन बिग हॉस्पिटल्स व्हिच हैव मेड द मनी. So if this has to be brought out, how is it to be done and who is, at least from your forum, that is the IMA, that is the medical council, how do they come forward and spread this message to the people?
डॉक्टर्स ने बहुत पैसा बनाया है, बहुत ही करेक्ट स्टेटमेंट है, नंबर वन। डॉक्टर्स ने जितना बनाया चाहिए उसका 1% भी नहीं बनाया है, ये भी बहुत करेक्ट स्टेटमेंट है। अभी परेशानी या हमारे समझने की चीज साहब, हमारा नजरिया जो है वो डिस्टॉर्टेड हो गया है। आई डू नॉट अंडरस्टैंड व्हाई पीपल डू नॉट अंडरस्टैंड दिस पार्ट. And I will give you an example from my own personal life. I was in United States few years back, where my mother-in-law had a heart attack. Stenting was done and she was on ventilator. Total bill was around $70,000, which would be 50 lakh rupees. Who did the job out there is junior consultant out there. In United States, you cannot question them. You know, there is a protocol which you follow. The same job will be done in my Apollo by the top leading consultant only for 5 lakh rupees. Where is 50 lakh? Where is 5 lakhs? See, the problem हमारे साथ क्या है कनीजा जी, हम लोग बहुत गलत अंडरस्टैंड करते हैं डॉक्टर को, एंड आई से विद लॉट ऑफ रिस्पॉन्सिबिलिटी। आज मेरे दोनों बच्चे दोनों ही डॉक्टर नहीं बनना चाहते, मैं और मेरे वाइफ दोनों डॉक्टर्स हैं, एंड आई एम वेरी हैप्पी कि दे डोंट वांट टू बिकम अ डॉक्टर. The amount of risk which is involved for the amount of money they earn, there is a huge discrepancy. एक डॉक्टर in India is available for a consultation fee of 200 rupees to say 1200 rupees easily online. To try to get the doctor in United States. See, problem, I do not understand. The biggest problem is I've been practicing in Hyderabad for more than a decade. And my personal opinion over the years, 10 years if of this is कि सबको साहब ट्रीटमेंट चाहिए यूके एंड यूएस स्टैंडर्ड का. कहां पे चाहिए? हैदराबाद में चाहिए, नहीं तो मेट्रोपॉलिटन में चाहिए. पेमेंट वो करना चाहते हैं गांव के लेवल का. 50 लाख का ट्रीटमेंट हमको चाहिए है, हम 5 लाख खर्चा नहीं करना चाहते हैं, हम देना चाहते हैं उनको 500 rupees to 5,000 rupees, which is what is killing our society. Be very crystal clear. If you want the best, you better pay the best and be ready for it. Everybody, why are you getting insurance done? What is the biggest difference between Western world and Indian world? Western world is 99% are insured. I think 1% are only the expats who are kind of illegal immigrants. In India, we do not have even 15 to 20% से ज़्यादा insurance नहीं है. That's why they cry. Anybody who wants an MRI CT scan done or wants to see a neurologist or cardiologist, you get appointment after 6 weeks to 6 months in Western world. In India, आप 1 घंटे में मिल जाता है, हम आपको दिलाएं. Doctor in the world are Indians. Yes. Treat them in the best way possible. जितनी भी फीस ले रहे हैं वो बहुत कम फीस में बहुत ज्यादा रिस्क लेकर के हमारी सोसाइटी को बचा रहे हैं. एंड आज अगर उन्होंने एक बैकफुट ले लिया साहब, आपको पता नहीं कि कितनी कैटास्ट्रोफी हो जाएगी. यू नीड टू अंडरस्टैंड दिस. आई वॉज इन श्रीलंका 5 years back. द चीपेस्ट ड्रग्स अवेलेबल, मेडिसिन अवेलेबल इन द वर्ल्ड आर इन इंडिया. चीपेस्ट ब्रांडेड मेडिसिन होने के बाद भी हम लोग थोड़ा सा बहाव में बह जाते हैं एंड हम लोग कहेंगे सर यहाँ पे इतने रुपए सस्ती मिल रही है. Yesterday I had a lady in सनत नगर 563 शुगर के साथ आई थी. वो पूछ रही थी सर कि मैं यहाँ से ये दवाई ले रही हूँ. मैंने कहा आपको खुद ही पता है कि आप सब स्टैंडर्ड दवाई ले रही हो, तभी आप पूछ रहे हो ना. आपको पता है कि मैं डायबिटिक की पेशेंट हूँ लेकिन मैं ये दवाई ले रही हूँ. तो मैंने कहा आप ये क्वेश्चन क्यों पूछा? क्योंकि आपको डाउट है कि आप सब स्टैंडर्ड दवाई ले रहे हैं. दैट वाज द आंसर. मैंने कहा आप ये टैबलेट ले लीजिए, आप ठीक हो जाओगे. हमको ये समझना है, aren't we interested in eating the best food? Aren't we interested in making sure कि हमारे बच्चों को बेस्ट एजुकेशन मिले? तो why we are taking back foot in taking the best medical care? And for that, अभी हम लोग आरोग्यश्री या आरोग्य भद्रता या कोई भी बात करें, आयुष्मान भारत की बात करें, it's all about insurance. आपको और हमको ग्रुप इंश्योरेंस या जो भी इंश्योरेंस अवेलेबल है वो लेनी चाहिए. आज हम लोग 5,000 रुपए बचाने के लिए 5 लाख रुपए खर्च कर रहे हैं. आज हमारा इग्नोरेंस is what is killing us, and with the same ignorance we are killing our saviors, I hope that message gets communicated right way.
Yes, yes, that's very important, doctor. And also now, as we come to it, affordable health care. What would it be? It would be insurance, private insurance, Ayushman Bharat, Arogyasri, because हमारी society different levels की है. We have different stratas in the society. So how can we identify affordable health care and the universal health coverage that we are all trying to push in the country? And what is the best means and ways of achieving it?
Thanks for that meaningful question. Rather, I would want that to be heard properly by all of us. Is it by various government schemes? Is it by, forcing people to get into the proper paper they carry? The only one answer of perfect healthcare is empowering our citizens. If we understand that, we provide the best care at the cheapest rate in the world. Only thing is empowering our chai wala, thela wala, our maid servant, our IT hubs, our doctors, everybody with the right information. If that can be done, that will be the biggest win and the biggest thing which we can do it for our society. I would want to give one acronym as I talk about the 6 top killers of the world on this April 7th, that is the World Health Day. What are the top 6 killers? Number 1, heart attack. Number 2, stroke or the paralysis. Number 3, COPD. Number 4 is pneumonia. Number 5 is neonatal deaths. Number 6 is trachea, bronchus and lung cancers. This is the data of 2019. What we can do about it, please take this acronym called as HEALTH. 6 letters are there. H is for heart checkup whenever your doctor suggests, whenever your spouse suggests. Heart checkup karwaiye. 100 ECGs will keep you alive for 100 years. Don't say no to any checkup whenever your doctor Chacha suggests you. E is for exercise daily and excess salt to be avoided to prevent stroke or paralysis. साहब टीवी के सामने हम बैठे रह करके प्रोग्राम देखते रहेंगे और आईटी का काम करते रहेंगे, एक्सरसाइज नहीं करेंगे, आपको स्ट्रोक होगा, आपको पैरालिसिस होगी. A is for appropriate pulmonary function test and following appropriate exercise pattern to fight out COPD. What do you mean by that? Breathing exercise. Hold your breath for 100 seconds every day to live for 100 years. It's possible. अगर आप अभी होल्ड करेंगे तो 20 seconds होल्ड कर पाएंगे, उसके बाद you will have that breathlessness. Exercise करिए, प्राणायाम, और ऑनरेबल प्राइम मिनिस्टर said योगा में विश्वास करना है, very important. So if we can do the breathing exercise, we can fight out COPD, we can fight out the 4th number killer in the world, which is pneumonia. Why we get pneumonia? Because our pulmonary exercises, breathing exercise हम लोग को आदत नहीं है करने की, pollution बहुत फैल रहा है. Pneumonia इसलिए होता है because we are not taking the time tested vaccinations. Flu shots, pneumococcal vaccine, every asthma patient, diabetic patient, smoker should take it. Every elderly should take flu shot. So this is the way we will be able to fight out the 4th biggest killer, which is pneumonia. The 5th killer is, what we call it as ANC care. Take ANC care for your pregnant mothers. If we can do that and assure institutional deliveries, उसका मतलब क्या है? हर एक माँ और जच्चा बच्चा इंस्टीट्यूशन को जाना जरूरी है, हॉस्पिटल को जाना जरूरी है, नर्सिंग होम को जाना जरूरी है. घर में जरूरत नहीं इलाज की. आई थिंक बहुत अच्छी सेवाएं हैं हमारे तेलंगाना में भी हैं, जहाँ पे अजीब सी स्कीम्स दी हुई हैं, उनको फॉलो करिए. एक जागरूक सिटीजन होना बहुत जरूरी है. हम लोग इतनी फैसिलिटीज अवेलेबल है. Our services are the best services in the world. The only thing is कि we do not use them in the right time. So जच्चा बच्चा की health will give us a healthy society. माँ को सशक्त होना बहुत जरूरी है, पौष्टिक आहार की बहुत जरूरत है. हर एक मदर को अनीमिया का ट्रीटमेंट लेना बहुत जरूरी है अगर वो प्रेग्नेंट है तो, और उनको रेगुलर इन्वेस्टिगेशन कराने चाहिए. The 6th disease which kills us is a trachea, bronchus and lung cancers. Easy way, have a smoke-free society. Make more stringent actions to be taken the way we are taking for the smoking, for the alcohol, for the all the other possible things. Pollution-free society, and that is what we need to do it. Finally, H is have a blessed approach towards your health. The biggest problem is we are staying away from three I's. I would want it to be scrolled down. One is I is investigations. जब कभी भी कोई डॉक्टर इन्वेस्टिगेशन लिखता है, what do we say? Sir, is it needed? अवसरमुंदा, जरूरत है क्या? अरे भाई, जरूरत नहीं होगी तो डॉक्टर will not write an investigation. Number one. Number two is insurance. Please, everybody, everywhere in the world, rather I point out everybody should have two insurances. One is private sector, one is public sector. And the third I is information. Investigation, information, and insurance. These three will keep your family healthy for 100.
Yeah, thank you. Thank you very, very much, Doctor. And I think these three I's are the most important message that you have given to all of us. Everybody who is watching this show will be more than happy to understand that these three I's will keep us healthy and will also keep us financially stable, which is most important for all of us post-pandemic. Thank you. Thank you very much, Doctor. Thank you.
Thanks a lot, Kaniza ji and the whole team for this blessed time. I really congratulate you. The kind of work which you're doing is way beyond the words congratulations. You're doing a good job. May God bless you and keep
Yeah.
in touch. Take care. God bless.
Thank
Namaskar.
you.